Hello, and welcome to the pharmaphorum podcast. My name's Dominic Tyre, and I'm pharmaphorum's creative and editorial director. For episode 30, I spoke with Dr Ashton Harper, who's head of medical affairs in the UK and Ireland at Roche Diagnostics, about the pressure COVID has put on healthcare systems and how pharma can help alleviate that. We looked at how Roche is involved in helping tackle the pandemic and the place of testing in global responses to COVID. Dr Harper also gave an overview of the different types of COVID tests that are currently available and where quantitative antibody testing features within this. It's one of the areas Roche is working on. You can find more details of this episode, including a download link for the podcast and information about other instalments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast, Stitcher and Podbean, where you can find and subscribe to it by searching for pharmaphorum. So Ashton, I'd like to start off perhaps with asking you to give a quick introduction to yourself and your role at Roche.
Yes, of course. Well, thanks, Dominic, for having me on. So my name is Ashton Harper. I'm currently the head of medical affairs at Roche Diagnostics UK. And I manage a team that look after clinical trials within the UK using our diagnostic technologies in a range of therapeutic areas, including oncology, cardiology, critical care, women's health, neurology, and infectious diseases. For those listeners who don't know about medical affairs, really these are teams within pharmaceutical diagnostic companies that really are responsible for, above other things, managing clinical data generation and then communication of that to healthcare practitioners with the aim of continually enhancing the care of patients. And before joining Roche last year, I had been working in medical affairs for 5 years, and before that worked in the NHS as a doctor before specialising in gastrointestinal surgery.
And as you say, as a former NHS doctor, of course, your current company, Roche, is quite heavily involved in the current fight against COVID-19. What's your take on the effect that the pandemic has had on healthcare systems in general? What the kind of pressures that it's put them under?
Well, I can only imagine the pressure NHS staff are under at the moment. I know from experience how stressful and draining some days can be working on the front line of the NHS. And, from my previous experience, what was good is that these days never sort of stretched on indefinitely. But now with COVID, it seems that there's little respite. And the majority of my friends are still working in the NHS up and down the country. And, whether I'm speaking to people from Manchester, the Midlands, London or Brighton, the picture is the same. It's pretty bleak, really. I think, there's staff shortages, lots of staff going off, quarantining with COVID themselves. A lot of people having to work very long shifts, and the emotional burden of frequent deaths claimed by COVID can't be underestimated. So I think there's a huge impact this is having on NHS staff, and I wouldn't be surprised if people are going to have sort of PTSD following this. So and we were seeing reports in the news at the moment that although rates seem to be falling, clearly that there's still a huge impact, a growing impact, particularly for critical care services. I think it's putting the NHS under incredible strain.
And what would you say is the role of the pharmaceutical industry? How can the sector, do you think, help alleviate some of these pressures that healthcare systems like the NHS have been put under?
Yeah, I think there's many ways in which pharma can help to alleviate these pressures. I suppose if we think about it, you've got obviously vaccines. It's great to have these vaccines now available, and it provides a light at the end of the tunnel. We also have medicines as well that have been tested in trials, such as antivirals like remdesivir or monoclonal antibodies, and then also vitally important are diagnostic tests. Although it's great that we've got these vaccines now, we're clearly not fully there yet, and we still need to be vaccinating considerable greater proportion of the population than we have achieved yet. I mean, we've done some great things so far, but it really needs to be rolled out to estimates suggesting more than 80% of the population needs to be vaccinated to get the R number under 1. And I think until we do that, diagnostics play a really vital role in identifying infectious cases and effective, so that we can effectively isolate those individuals, quarantine them, and break lines of transmission. And similarly, with the rollout of vaccines, we need to know how effective those vaccines have been. So whether our immune systems have responded to those vaccines, and again, that's where diagnostics plays a really important role.
And so within that, I'd be very interested in hearing about how your own company is involved. What's Roche doing to help tackle the pandemic? When did it start focusing on that?
Well, Roche has been involved since the beginning of the crisis in the UK. As soon as we heard about the pandemic, our team has set about analysing the genetic sequence of SARS-CoV-2, and within less than a month, we created and validated a new diagnostic test that could detect the virus. And when you consider that a process like that usually takes about 2 years from start to finish, so the sheer pace of progress is astonishing. And we did this quickly because we knew that before mass vaccination was a possibility, and natural immunity would obviously take a long time to happen. The only way of suppressing this virus would be to identify those that are affected, and isolate them and trace their contacts. But since that initial test, we've been developing more and more, and we've added to a substantial portfolio that also looks at other things like COVID antigens as well. And so we have rapid tests for that, but also antibody tests, which can tell you whether you've been infected previously and you've mounted an immune response.
And so, of course, rightly, I guess there's an awful lot of focus on vaccines and the hope, albeit maybe a slightly longer term hope, that they will help bring about an end to the pandemic. But when we look at the role for testing for COVID, how important do you think that is now, and how important will it continue to be in the future?
Well, I think testing is incredibly important. Before the vaccines were here, as I said, the only way of really being able to bring the R value below 1 and stop the dramatic increase in infections would be to identify those who are infected and to be able to isolate them and quarantine them and break those lines of transmission. So that was really important at the start, and that actually continues to be really important. If we look at cases or countries where the infections were brought under very strict control very quickly, such as Australia. I think since the end of September last year, they had virtually eliminated most cases. And if you look at what they did, they did a number of things, such as early closure of borders, and restricting civil liberties. But they also quickly and aggressively traced, and isolated cases. And I think that's really central to the control, the really excellent control they got over COVID. And then you sort of fast forward to a case from Europe recently. So, in Slovakia, in October, November time, they were the first country in Europe to conduct whole population mass screening. And through that process, they identified more than 50,000 cases that wouldn't otherwise have been identified. And they showed that there's other measures as well, again, restricting civil liberties, but they were able to reduce the prevalence of infections by an estimation of about 60 to 70%. So I think that really shows how important testing can be. And talking about the future, as the rollout of vaccines continues, we're going to need to know whether these have been effective. And so we need to have some idea of the immune system's response to these. And we know from trials that vaccines, like all medications, that they're not 100% effective. So some people, hopefully most people, are going to mount an immune response that is going to protect them from subsequent infection or from reinfections. However, we need to have some way of detecting this. And I think this is going to be the really, really important role for diagnostics moving forward, to be able to identify whether these vaccines have been effective or not.
And so if we look at the different types of COVID tests that are currently available, and there seem to, certainly from an outsider's point of view, it seems to be a few trade-offs in terms of whether you're looking for the highest possible accuracy versus the highest possible speed and getting answers back. But could you give us a little bit of an overview maybe about the different types of COVID tests that are available?
Roche has developed a range of different tests for COVID, and I would categorize these into tests that identify the presence of the virus, those that identify the immune system's response to the virus, and those that are not specifically about COVID but give us a picture of the severity of disease. So, for instance, is IL-6. For the tests that are identifying whether the virus is there, we have PCR testing. And this is a test to identify basically the genetic material of COVID-19. And so the PCR tests are incredibly sensitive. They can identify very, very minute amounts of viral RNA in the system. And but these may take up to a day or two to get results. And these are conducted by high-tech machines inside of hospitals, so it's not as quick an option. So what we've also then developed are more rapid turnaround tests. So things that are called lateral flow devices, and these work in a slightly different way, but they pick up antigens. So this is viral proteins rather than genetic material, and these tests can be conducted in the community, and they don't have to have these large hospital-based machines, and they give a very quick turnaround of 15 to 30 minutes. So what they still require to have a healthcare practitioner involved in taking the samples, but they do give very accurate results, but they're not as sensitive as the PCR tests. Now, there has been there's actually quite a big debate about this at the moment, about these lateral flow, these rapid tests. Now, although, as I say, they're not as sensitive as the PCR tests, what they do is they are very good at picking up very high viral loads. And individuals that have a high viral load have been shown to be at a greater risk of passing on infection, so being a transmission risk. And so if we can identify these individuals by rolling out regular mass testing, then we could potentially be identifying cases of high viral loads that may be transmitting the virus that we wouldn't otherwise know of. So they also have a very important place, and obviously the quick turnaround and the fact that it doesn't need large machines is an added benefit. And so those are sort of the tests to identify the virus, and then what we also then have are the tests to look at the immune system. So again, we have tests that can identify antibodies, and there's those that again are based on machines in hospital that they have a very quick turnaround time, but they require these large machines. But we also have these rapid tests as well that just require a capillary blood sample, so just a finger prick of blood. And again, these are highly accurate, and they don't require these large machines, and can be done in more remote settings. So those are sort of the broad categories of tests.
And so within that, if we look at quantitative antibody testing, is that focusing on that sort of IL-6 testing for where you're looking at the immune system, or where does quantitative antibody fit in?
So our new quantitative antibody test is looking for it identifies antibodies to the spike protein of SARS-CoV-2. And this spike protein is what's responsible for attaching to specific receptors in our cells, and it's sort of the initial stage of the virus infecting our cells and causing disease. So antibodies that are able to bind to that spike protein essentially prevent infection of our cells. And so these antibodies are thought to be incredibly important for preventing infection. And certainly both human and primate studies have shown that these are an important correlate of protection against COVID-19. So this test that we have, this quantitative test, actually is measuring these specific anti-spike antibodies, and not only detects them, but detects what level they are, so that the quantity. And although we don't have a clear picture at the moment of exactly what titer of antibodies is essential for protection from reinfection, it's clear from a number of studies that the more of these antibodies you have, the greater protection that that you will have from reinfection. So this is a really important test to identify whether we either have good protection following natural infection or also from vaccination. And the reason for that is that the current vaccines that are approved for use, so Moderna, Pfizer, and the Oxford vaccines, have all focused on this spike protein, so eliciting an immune response to this spike protein, and therefore we're looking at those antibodies that these vaccines have elicited.
And in terms of the testing work that Roche is currently doing, is that something that you're looking to run in tandem with vaccine trials or alongside vaccine trials?
Yes, exactly. As I say, the leading vaccine companies are targeting this spike protein, and we are working with a number of companies alongside future vaccine trials to identify the effect that these vaccines are having in producing these anti-spike antibodies. So yes, that's something that we're doing.
And so to sum up then, Ashton, what do you think the pharmaceutical industry's role in the fight against COVID is going to look like throughout the rest of this year for 2021?
Yeah, that's a good question. I mean, what I would say is COVID-19 is not going away. I mean, the pandemic continues to rage on around the world. And whilst it does, we're going to continue to need diagnostic tests. These tests are really providing light in the darkness. We in many cases, like I said at the beginning, if we can't detect who's infected, we can't then isolate those individuals and break lines of transmission. So these PCR tests and these antigen tests are going to continue to be really important for identifying infection in different populations. And then as the vaccines are rolled out, as I say, it's going to be really important to know whether they've been effective. As I say, they're not always 100% effective. So it's going to be important to detect those people where the immune response has not been adequate to provide protection, and therefore identify those who may need to have booster vaccinations or may actually need to be isolated or have other treatments. So I think there's certainly a huge role for diagnostics into 2021. And I think another important point is that there's the indirect impact that COVID-19 has had on many services. And for instance, a very worrying example is sort of the mounting cancer backlog. And there's recent estimates from Macmillan that across the UK, there's tens of thousands of missing diagnoses. And so this is going to be something that diagnostic companies like Roche are going to have to work really closely with the NHS to try to bridge this gap and to effectively pick up on those misdiagnoses that have been the result of this terrible pandemic.
Absolutely. So it's certainly an awful lot for the pharma industry to do into this year, or the rest of this year, and into next, I think. But Ashton, thank you very much for joining me on this episode of the pharmaphorum podcast.
Thank you very much.
And that concludes episode 30 of the pharmaphorum podcast and my discussion with Dr Ashton Harper from Roche Diagnostics about healthcare during the pandemic and the role of testing. You can find more details of this episode, including a download link for the podcast and information about other instalments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast, Stitcher, and Podbean, where you can find and subscribe to it by searching for Pharmaphorum. And don't forget to visit our website to sign up for daily or weekly email pharmaceutical news and analysis bulletins, and follow us on Twitter, where we are at Pharmaphorum.